Dr. Devyn Parsons, you are a family physician and an obesity specialist. What does your day look like? Like when you come in to go to work, like what do you do from when you start until when you finish? Mm-hmm.
Yeah, my day is comprised of a million little tasks and patient visits. So I've incorporated my obesity practice into my family practice clinic. So it's all sort of amalgamated into one. So when I arrive at work, I usually start seeing patients. And in between seeing patients, I'm going through my inbox to check labs and investigations and trying to call patients to go over those at the same time as seeing patients from about 9 to 5.
9 to 5. And in that period of time, how many patients on average do you see?
It really depends on the day, because sometimes if there's a more complex patient, then, I might spend a longer visit with them. Other days, if things are a little bit simpler, then we can see more patients, but it could be anywhere from 25 to 35 patients on a typical day.
My, oh my, how do you stay on top of all that? Because each patient who comes in is seeing you for different reasons.
Yes, well, and actually, I probably see lower amount of patients on average compared to many of my colleagues. So I'm towards the lower end of efficiency there. But I like spending a little bit more time with my patients and having the opportunity to chat with them as well. So I usually just try to get all the work done for that patient at the same time as the visit. So once I'm done sort of assessing them and helping them to manage whatever problems brought them in, then I'll try to fire off any referrals to specialists, deal with any investigations right at the time so that I can be done all of that before I move on to the next patient.
But you also have to fill out prescriptions. Do you have to interact with pharmacists and so on?
That's right. Yeah, all of that sort of gets fit in there where it can, usually sort of 2 minutes for this, 2 minutes for that. And usually while my assistant is sort of taking one patient out of the room and getting the room set up for the next, that's when I'm calling people about results, going over investigations and calling pharmacists, all of that stuff.
So what's the level of intensity then? Like, do you get little breaks between things? Because I know that when I'm working intensely on something, I need to have a break. Do you get those breaks?
You can only get those breaks if you plan them into your schedule yourself. So, any break that you're taking is, one fewer patient that you're seeing that day. And for many of us as family doctors, we're trying to take on as many patients as possible to help with the crisis and the shortage of family doctors. So there's certainly a pressure to try to fit in as much as possible in your day to avoid falling behind or having to turn people away who are in need of your services.
So do you get in much before you see your first patient? Like, do you have half an hour or so to get sort of set up and get a sense of what's coming at you for the day?
Yeah, I usually do a review of my schedule on the weekend before going into clinics, that I can get a sense of what people are coming in for. And if there's anything that, I haven't reviewed in a while, I might do some reading around it, refresh my memory on different conditions. And then on each day before clinic, I spend about 30 or 40 minutes trying to get caught up on my inbox and investigations before the day starts.
And at the end of the day, are you having to then go back and say, oh yeah, I got to make sure that I do this and do that? How much time after you stop seeing patients are you still there?
Yeah, the end of the day is the beginning of the paperwork in some ways. So, on a good day, I might spend 20 or 30 minutes at the end of my day. On a day where things have gotten away from me or it's been a busier day, I might spend an hour or more time in the evening trying to catch up on all of that.
Wow. So with patients, they all have different reasons to be there. How do you stay on top of the latest understanding about how to deal with 1,000 different potential ailments?
Yeah, well, we in the medical community, what's called continuing medical education is a really important part of our professionalism. So, we usually all take some time out of our busy practices to attend conferences or do courses to stay up to date on certain areas of interest. I also do a lot of reading around my patients. So if someone comes in with something that I haven't seen before, or a specialist has prescribed a drug that I'm unfamiliar with, then usually when I come across that, I'll spend some time reading about it and familiarizing myself with it.
Wow. It's a lot of work. How many hours a week do you think that you put in?
Well, I wear a few other hats beyond my sort of clinical roles. So
Oh.
for me, I probably spend about 30 to 35 hours per week doing my sort of clinical work. And then on top of that, I help to design the academic curriculum for one of the family medicine residency programs. And I do a few different teaching roles for medical students and residents as well.
Do you get to sleep?
Not that often. But honestly, I consider it a privilege to do this work because it's really so fulfilling, and I think it's the best job in the world for me anyways.
You love the work.
I do. Yeah, it's, at the end of the day, the paperwork I don't love quite so much, but when you reflect back on sort of all the different people that you got to speak with and interact with and get to know, it's pretty fulfilling.
So at what point in your life did you say, yeah, that's the path that I want to follow?
Well, by the time I was in high school, I knew that I was interested in sciences. And I think that, at that stage of life, you're kind of aware of, only a handful of different jobs. I was, I can be a doctor, a lawyer, or a teacher. And so I said, well, I'll go to do a degree in sciences in undergrad with the idea that I could go to medical school, but staying open to the idea that if I came across something, that grabbed me more, I could, go into that along the way. And nothing ever grabbed me more. And the more experience that I had, working in volunteer positions in healthcare, the more I became interested in working in a profession that combined not only the science side of things, but that real human interaction aspect.
Mm-hmm. So was it like biological or life sciences that caught your interest? Because science is a broad topic.
Sure. Yeah. I did a combined degree in biology and psychology. And, on many days, I feel that psychology actually helps me more in my day-to-day practice.
Oh, isn't that interesting? So you graduate from high school. What was the next step for you?
So I went to the University of Victoria to do my combined degree in biology and psychology. And throughout that period, I had my sights set on medical school. So I did quite a bit of, research, volunteer work that was, really interesting and engaging in its own right, but also with that sort of view to setting myself up for that application.
Why was volunteer work an integral part of being able to get into medical school?
Medical school is extremely competitive to get into. And what they look at is not only academics these days, but also your volunteer work, your research. I have no insights into the admissions program, so I can't really sort of say in detail, but it's well known that you need to be a well-rounded applicant to stand a chance of being admitted.
So where'd you go to school?
For my undergraduate?
No,
for medical school? I went to the University of British Columbia.
So what was that like, getting into that, and what was the sort of commitment that you had to bring to it? Because I understand it's grueling.
Yeah, it is a challenging experience, but I think you go through it with the whole rest of your cohort who are going through it at the same time. So it was really thrilling for me. I actually found out the day that I got in, I was in my own family doctor's office speaking with her when I got the email saying I was admitted. So it was sort of a special moment being able to tell her that she'd been my sort of mentor throughout my journey that far, and to share getting in was really exciting.
So what do you think is an essential, personality or characteristic trait that sets you up, or somebody who might be watching and saying, well, I want to be like you? What do you say are the sort of essential elements of their character and personality that they need to be able to succeed in medicine, and in particular family medicine?
Right. I think that you have to really like learning. It's a long academic pathway, and you need to go through medical school and residency and sometimes a fellowship, and then keep up with sort of ongoing medical education, as we were chatting about. So I think, being someone who really enjoys learning and doesn't see that as, a chore is something that I think is really helpful. And then I think, to be successful as a physician, you need to be someone who really enjoys connecting with people and has a real interest in getting to know people and supporting them as they go through some of the most challenging moments in their lives. So I think that combination of those two things tends to be helpful, and a willingness to work hard.
Yeah. You just touched on something that you got to remember, that you're not, seeing people on their best day.
That's right. Yeah, no, and I think that something that we think about all the time in medicine is that sometimes someone might seem, a little frustrating to deal with or emotional, but if you take a step back and you realize that you're often seeing them on their worst day, right? When they're most afraid or vulnerable. And I think that can increase the amount of compassion that you have for people in those moments.
But it must be an extraordinary career knowing that the work that you do can have such a profound impact on the quality of life that other people have.
Absolutely. I think that is the biggest privilege of being in my profession, that, I get to go home at night and feel really proud of the work that I've done and that it's helping people. And, having a job where people actually thank you for the difference that you've made in their lives, that's pretty special.
Yeah. And it's worth it. It's worthwhile work.
I think so.
Yeah. Thank you very much.